Recently, folks, I had to have an above knee amputation performed on my left leg. I'll give you a little history about myself. My name is Terry Basham, and I suffer from peripheral vascular disease. And this causes the circulation in your arms, legs, fingers to deteriorate, and eventually ends up causing you to have amputations. Um, when my left leg was amputated, or rather, I'm sorry, my right leg, when it was amputated, it was done at the Richard L. Raudebush VA Medical Center in Indianapolis, Indiana. And the surgery was a horrendous nightmare for me. The chief of surgery performed the operation um, and did a horrible job closing the wound. The wound looks terrible. It remained extremely painful and still does when any pressure is placed on the end of the stump. And on the date that she did this, which was December 21st, 2005, she did this at the end of the day, performed the surgery, and immediately left the hospital without writing orders in the chart for medication to relieve my pain. When I left the recovery area and returned to my room, I awoke in horrible pain and rang for the nurse. It took 55 minutes for the nurse to respond. When the nurse did respond, she went back to the nurse's station, and I didn't see her again for 4 hours and 44 minutes. When she did return, right at the end of her shift, she asked me what it was that I asked her about earlier when she was in, and I said, pain medication? And she says, oh, I looked in your chart and the doctor didn't write any orders for pain medication, so I can't give you anything. I said, what about Tylenol, aspirin, over-the-counter medications? No, we cannot issue any type of medication without a written doctor's order. I said, so that's fine. Summon the doctor. They refused to summon the chief of surgery. They refused to summon the chief resident on duty that evening. They refused to summon the doctor, which is called the officer, or the officer of the day. And so I laid for 2 days and 11 hours with no relief whatsoever after an above-knee amputation. I was tempted greatly to go out and try and find a drug dealer. I was in so much pain that it was just absolutely unimaginable that it could get any worse. Finally, as I said, 2 days and 11 hours later, she didn't return, but one of the surgical residents did, and he wrote a prescription to give me one of the PCA pumps and gave me a very strong, potent pain medication. But after 2 days, when we began the medication, it took almost 3 days for the pain to go away. And in addition, there was swelling and fever, and I was taking antibiotics, which were making me sick to my stomach. I reported that, or tried to, and no response to that. So when my left leg began failing, I had determined that I would not use the facilities at Richard L. Raudebush VA Medical Center in Indianapolis. It seemed that they were uncaring about the suffering and the pain that I experienced. And it seemed like the chief of surgery was so stuck on herself that she couldn't come and check on me after the surgery. So, anyone with that type of an attitude, I don't want working as my doctor. When the left leg became so infected with abscesses and problems because of the poor circulation, I went to the Lakeshore Bone and Joint Institute in Northwest Indiana. They have offices in Portage, Valparaiso, and Chesterton, Indiana. I had been referred by a very good friend to see Dr. Bruce Thoma, Thoma. I must say, when I first met Mr. Thoma, or Dr. Thoma, rather, I was really surprised. Dr. Thoma has a bedside manner that is second to none. When I first seen him in his clinic, he looked at my leg and diagnosed that the amputation was indeed necessary. I was concerned about the leg being about the same approximate length as the stump. And he told me that would not be a problem. He scheduled the surgery, and on April 29th, which was about 2 weeks out, I went in to the hospital, and it wasn't the VA Medical Center. This was Porter Hospital in Valparaiso, Indiana. Dr. Thoma came into my room the day before surgery. He sat down and he explained to me every detail of the surgery that he was going to perform. I expressed to him what my concerns were based on the events that happened at Richard Raudebush VA Medical Center in Indianapolis. And he assured me that this wouldn't be the case here at Porter. Dr. Thoma sat for over 40 minutes in my room. Now, this is a man who has hundreds of patients. He's very busy. I can't imagine how he found 40 minutes to sit and speak with me, but he did. And then the day of surgery, he came to my room before the surgery and spent 27 minutes with me, explaining everything, asking what my concerns were, what my desires were, how he could do anything to make me comfortable. I expressed my fear about pain medication. He says, not a problem. We will take care of you as best we can. And he performed the surgery. Now, one of the things that's difficult when you're about to undergo surgery is not knowing what the process is and what will be done. But I have to say that Bruce Thoma went out of his way to make certain that I was knowledgeable of every step that was going to be taken, and he walked me through it. I went through pre-op, then I seen him in the operating room before they put me to sleep. And when I awoke in recovery, he was standing at my bedside and spent another 30 minutes with me. I was sent to my room, and the following morning, Dr. Thoma was there bright and early, checking on me, asking if I had any needs, comforting me in a way that only he can do. His bedside manner is impeccable. He truly and genuinely cares for each of his patients. If you are not a patient of his and need knee replacement, amputations of any sort, or orthopedic surgery, I highly recommend that you look into Lakeshore Bone and Joint Institute. They are probably the very finest institute in Northwest Indiana when it comes to orthopedic needs. They perform other services as well. The clinic is second to none as far as comfort, and you are made to believe that they care, because they do. The doctors there are genuine. The doctors there are friendly, and they go out of well beyond their call of duty to care for their patients. Now, Lakeshore Bone and Joint Institute has no way paid me for this video. I just simply want to express that I have received astounding service, astounding care under Dr. Bruce Toma, and I wanted to let others know that if you have to undergo painful hip, knee, leg surgeries or amputations, this is the place to go. You can ask others who have been in his care, and I'm certain that everyone that this man has ever had a doctor-patient relationship with has walked away happily. Once again, I highly recommend Dr. Toma and the Lakeshore Bone and Joint Institute. They truly care about their patients and have wonderful, beautiful facilities for their clinics, post-operative care. They provide physical therapy for our physical therapy needs. Beyond that, there's nothing more that a body needs. So, again, recommend them highly. And I praise Dr. Toma because there are very few doctors that are so caring that they spend such time with their patients. This man truly does. Thank you for listening to my video, and have a great day.